Thank you, Sue. Thank you, Dan. I am honored to be here today to share with you a little bit about our organization, StopAfib.org, and to be part of this initiative with the Alliance for Aging Research and with the Preventive Cardiovascular Nurses Association. I'm an atrial fibrillation survivor. Once I was free of atrial fibrillation, I decided that I couldn't stand on the sidelines and watch other people suffer. I had to do something about it. And that's why I started this organization, StopAfib.org, so that those living with AFib knew that they were not alone. This is probably one of the most important things I can show you. We think of folks who have had heart attacks as having a poor quality of life, but those who have AFib have an even poorer quality of life. So you see the red bars are the quality of life statistics for those who have atrial fibrillation. The blue bars are for those who have had a heart attack, and the green bars are for controls, or basically normal folks. And you can see that those red bars are significantly lower quality of life than even those who have had a heart attack. And that's because those of us with atrial fibrillation are constantly watching over our shoulders, waiting for the next time the AFib beast is going to strike us. So our mission at StopAfib.org is to raise awareness of atrial fibrillation and of the strokes that result from it. We've partnered with many of the organizations that are, here in this room represented in order to raise awareness of AFib and strokes. And in fact, in 2007, when we launched our organization, we declared and worked with many other organizations to declare September as Atrial Fibrillation Awareness Month. We also are focused on educating patients in order to improve their quality of life and to help support their communication with their healthcare providers. And hopefully, through helping them get diagnosed and treated properly, we can decrease AFib-related strokes and prevent deaths. We are the #1 arrhythmia site on the internet and the #7 cardiovascular disorder site. That tells you that this is a really significant disorder when it comes to the heart. Atrial fibrillation impacts families, individuals, and society in general. And it has a lot of impact here in DC because the bulk of AFib patients are on Medicare. About 80 to 85% of AFib patients are 65 or older. So there's a disproportionate share that Medicare is covering. So this is really why I think it's important that we raise awareness here and raise awareness around the country so that we can decrease some of the cost of this very costly disease. So let me turn it back to Dan then.